Right, so this morning I gave a talk on the genetics of MDS to kind of help explain the underlying genetic changes that occur and drive the disease. So I explained how MDS is a clonal disorder that has somatic mutations in a wide variety of different genes that lead to the development of the disease. I explained how this is really a disease of disordered splicing, and about 2/3 of patients will have a spliceosome mutation, and also of disordered epigenetic regulation, where more than half the patients will have a mutation in one or more genes that affect the epigenetic state of the cells. I then went on to compare MDS to other myeloid malignancies like AML and myeloproliferative neoplasms to highlight how there are some unique patterns of mutation in MDS that really aren't shared by those diseases and might distinguish it, because any individual mutated gene can be found in any one of these diseases, but the pattern and combinations tend to be more unique to MDS. Finally, I went on to explain a little bit about how these mutations actually work at the molecular level and how we think they might be actually driving the development of the disease, and those rare examples where we actually might even be able to use the mutational information to help us pick a therapy for our patients. And finally, I did also speak a little bit about where we're headed as a community to try to understand how to use mutations in a clinical setting, in the sense of how to help us establish a diagnosis in patients, how to help us predict their prognosis, and ultimately how to better treat them.